Hey viewers! Do you have a dull, pounding headache that makes you feel sick? You probably have a migraine. A migraine is a neurological condition that includes severe and recurring headaches along with other symptoms. In today's video, we'll be discussing everything you need to know about it. Is a chemical imbalance responsible? What about monosodium glutamate, MSG? Can coffee be a trigger? We'll be talking about all of these and more. Did you know that a migraine is the third most common illness in the world? Don't just mistake a migraine with a regular headache. There is a huge difference. A headache causes pressure and aching, ranging from mild to severe. It usually occurs on both sides of your head. The most common type is a tension headache, which is triggered due to muscle strain, stress, and anxiety. There are other types of headaches including sinus and cluster. While headaches literally involve pain in your head, migraine includes a bunch of other symptoms, in addition to a headache. Let's take a look at the symptoms of migraine. You will have a throbbing sensation and intense pain on one side of your head. There will be a lingering pain behind one eye or ear. You'll be extremely sensitive to sound, light, and smell. Trust me, a little sound and light exposure will cause you discomfort. You'll experience nausea and maybe even some vomiting. There can be temporary changes in your vision, including spots or flashing lights. You may even lose your vision for a short period. I know, this can be extremely frightening. Do you suffer from migraines? What do you do to cope? Sound off in the comment section and start a conversation with our Bestie community. People who experience migraines know how painful they are. Aspirin is rarely effective. Depending on how often you experience symptoms, migraines can be episodic or chronic. If you have a migraine attack that lasts less than 24 hours and then weeks or even months pass between another attack, you may be having episodic migraines. On the other hand, if migraine symptoms appear for at least 15 days or more each month and for at least 3 consecutive months, you may be suffering from chronic migraines. The sad part is there is no single test for migraines. Your doctor will ask you about the symptoms and frequency of your attacks. In a study, it was found that people with chronic migraines experience a headache lasting an average of 65 hours without treatment and for about 24 hours with treatment. People with episodic migraines have headaches for an average of 39 hours without treatment and about 13 hours with treatment. So, what are the causes? Well, that's still a mystery. Some possibilities have been identified, but scientists still need to figure them out. Here are some theories for what causes migraines. Number 1. Chemical imbalances. If there's an abnormality in the required brain chemicals and nerve pathways are not clear, you may get a migraine. Feel like you're missing out? Make sure you join our millions of viewers by hitting that subscribe button and staying up to date on all our great Bestie content. Number 2. Central nervous system disorder. There's a possibility that you may have an underlying neurological condition which can trigger a chronic migraine. Number 3. Irregularities in the brain's vascular system. If there's difficulty in your blood flow or the size of your blood vessels has altered, you can experience a migraine attack. Number 4. Genetics. If your parents, siblings, or any close relatives suffer from migraines, your chances of having one increases. In some cases, chronic migraine can be an indication of other serious conditions like brain tumor, stroke, meningitis, or traumatic brain injury. Migraine triggers differ from one person to another, and it affects the same person differently each time. Let's talk about some of the common triggers for migraines. Number 1. Food. Yes, some basic foods can be a trigger for your migraine. I mean, sure, spicy food is delicious, but hot, salty foods are a potential trigger. Aged and processed foods like cheese and cured meats can also contribute to migraines. Number 2. Drinks. Your day is incomplete without coffee, right? You'll be disappointed to know that some caffeinated drinks like coffee and sodas trigger migraines. On the contrary, some of you might feel like having coffee during a migraine attack. This is because coffee provides relief from pain, but hold on, this can cause a rebound migraine attack. Even alcohol could be a trigger for some, especially wine. So if you're planning on partying this summer, always know your limits. Number 3. Preservatives and sweeteners. Do you like eating processed foods? How about frozen meals? Unfortunately, all of these food items contain a preservative called monosodium glutamate, MSG, which has been shown to trigger migraine headaches. For some of you, artificial sweeteners like aspartame can also trigger migraines. If you want to avoid this, read the labels before you consume. Number 4. Skipping meals. If you experience migraines, skipping meals is a big no-no. Fasting or skipping meals usually triggers migraines. But hang on, there's more. Suppose you normally eat your lunch around 2 p.m. If one day it's 4 p.m. and you still haven't had lunch, your chances of getting a migraine will increase. Try having meals at your routine time. Also, remember to keep yourself hydrated, as dehydration also triggers migraine. Would you like to learn more about the effects of skipping meals? You might want to watch our video on what happens to your body when you skip breakfast every day. Now back to migraines. Number 5. Stress and anxiety. You may have noticed your head going crazy the day before an exam. This is because during these times, your stress and anxiety skyrockets. As a result, you get a migraine. Not only this, but physical stress also has this effect. A really hard workout can put a lot of pressure on your head. Number 6. Bad posture. Many of you may not be sitting correctly while working, or even while watching this video. Poor posture can reduce blood flow through your neck, which triggers migraines. Number 7. Hormonal changes. Ladies, you may have noticed that you often get a migraine attack during periods. Some women experience more frequent headaches before and during menopause. This is all because estrogen levels change during this time, which triggers migraines. This is why both episodic and chronic migraines are usually more common in women than men. Number 8. Sensory stimulation. Many of you like going out to clubs, but is your head throbbing during this time? Loud music and flashing lights are the cause, not to mention all the booze. If someone near you has put on a strong deodorant, it can trigger a migraine, or make it worse. Secondhand smoke, room fresheners, and the smell of paint thinners also act as triggers for some people. Number 9. The weather. Going out to the park is fun for most of us, but it can bring on headaches for some. People who suffer from migraines are sensitive to bright light. You should also avoid sudden temperature shifts. Humidity and barometric pressure can also affect your migraine. Number 10. Sleep difficulties. If you're not getting the right amount of sleep, you'll have a migraine in the morning or later in the day. We all want a little extra sleep on the weekends, right? Sadly, too much sleep can also cause migraines. Routine sleep is the key. Keep your sleep between 7 to 9 hours. Number 11. Medications. You might want to have a look at your meds. Some of them can trigger migraines. For some women, birth control and hormone pills can also develop migraines. Also, if you purchase headache medicine over the counter and consume it for 9 days a month, you might experience rebound headaches. Always talk to your doctor for the right medicine that suits you. People who experience migraines know that it affects various aspects of their life. Focus and concentration decrease during a migraine attack. Productivity in both your work and personal life will suffer. The best you can do to manage your chronic migraine is maintain a migraine tracker. Prepare a chart stating the date and time of day you started experiencing the headache, timing of meals, and what you ate. You should also write whether or not you were stressed, the number of hours you slept, the current weather, and meds you're taking. Fill your migraine tracker religiously and you'll easily find your triggers. You can also seek help from your doctor or change around your lifestyle. Would you like to learn how to boost your brain health? Let's keep the conversation going with a couple more videos, shall we? Check out Top 10 Superfoods for Your Brain, or how about the 11 Worst Foods for Your Brain revealed by doctors? Go ahead, click one, or better yet, watch both and learn more about which foods to eat and which to avoid for maintaining the health of your brain. Did you know about these migraine triggers before watching this video? Let us know in the comments below.